All right. Hello and welcome everyone to our Wellbeing Connection class. Our first one for the month of July. My name is Charlotte Shine. I'm one of the Giant Company dietitians, and I have a special guest today, Haley Fromm, who is a pharmacist with the Giant Company, who's joining us today to talk all about diabetes management. So our topic for today is Diabetes Management 101 with our experts. So it will be a very interesting class for today. So our agenda, what we're going to talk about is what is diabetes, the importance of nutrition in diabetes management, understanding carbohydrates, the important role of fiber, fat, and protein, common medications and how they work, supplements for diabetes, and some vaccine recommendations for those with diabetes, and then do a Q&A at the end. All right, so just going over what is diabetes. So diabetes is a condition where the body has trouble using glucose or sugar properly for energy. An important statistic is that in the United States, over 38 million people have diabetes and 1.2 million Americans are diagnosed every year. It's definitely very prevalent, type 2 diabetes, and it has been on the rise. And actually, those undiagnosed are around 8.7 million. There's usually what's kind of interesting is that there's usually no signs of it. So always important to follow up with your doctor every year just to make sure that you don't fall into that category. So there's different types of diabetes. So the first one we have type 1. So this is the less common one, but it's an autoimmune condition where little or no insulin is produced and usually requires insulin for life. Type 2, which is the most common type of diabetes. So this is where the body becomes resistant to insulin or doesn't produce enough. But it often can be managed with lifestyle changes like diet, oral medications, or insulin. Then we have gestational. So for those who are pregnant, so usually develops during pregnancy, but usually resolves after delivery. But what's interesting is that it does increase future risk of type 2 diabetes. So you always want to follow up with your physician to make sure that that doesn't develop if you have had that during pregnancy. So reviewing what is insulin. So insulin is a very important part of diabetes. So what insulin is a hormone that is made by the pancreas that helps to control blood glucose levels. So breaking down even further of how insulin works. So when we eat a meal, the carbs that we do eat are broken down into glucose. So the glucose enters the bloodstream. Once it enters the bloodstream, the pancreas is alerted and then releases insulin. And insulin helps cells absorb glucose, and then the blood sugar lowers to normal. So insulin plays an important part in our bodies. However, if you do have diabetes with complications, if blood glucose stays elevated over a long period of time, it can lead to a variety of different conditions such as heart disease and kidney disease, vision problems, nerve damage, and death. Just a few of the main different types of complications that you can get. So we always want to make sure that our blood glucose levels, try to get that stable and healthy and normal. So the importance of nutrition in diabetes management. So nutrition plays a very important role in diabetes management. So we know that food affects blood sugar directly, but this is especially the case for carbohydrate foods. So we want to make balanced food choices. So when we make balanced food choices, incorporating a variety of different foods helps to keep that blood sugar in a healthy range, boost our energy and mood, mainly because we're not having those blood sugar spikes, ups and dips. Also reduce risk of complications, which of course we do not want, and helps to support a healthy weight, which can help our insulin. Some key nutrition strategies to think about when you have diabetes. So carbohydrate awareness, usually especially if we are eating and we're not very aware of how many carbohydrates that we are consuming, this can definitely affect our blood sugar. So we always want to be aware of carbohydrates in general, what are carbohydrate foods, and then how much that we're consuming. And you also want to include protein, healthy fats, and fiber. We'll go over this in a couple slides. Those are very important with blood sugar stability. Also, portion control is very important. Obviously, usually in America, we have, especially if we eat out, we have large size portions, but we always want to keep portion control in mind, but also regular meals. So definitely not skipping meals or snacks. Skipping always creates blood sugar imbalances. So we always want to have regular meals to keep our blood sugar stable and also to stay hydrated as well. So I really like this visual image. This is a diabetes plate. So if you do have diabetes or even pre-diabetes, You always want to keep this visual in mind, but we want to fill half of our plate with non-starchy veggies. And this can, of course, be easier to do this time of year because we have a lot that is in season. So vegetables especially taste really good right now. But things like asparagus, broccoli, cauliflower, Brussels sprouts, dark leafy greens, tomatoes, green beans, bell peppers, and those types of things. We want a fourth of our plate to be lean protein. So things like chicken, turkey, eggs, fish like salmon, cod, tuna, tilapia. These also have healthy fats that we definitely want to incorporate into our diets. Lean beef cuts like chuck, round, sirloin, and tenderloin, and then plant-based sources. So nuts, seeds, edamame, tofu, and the plant-based sources also add the additional fiber, which helps with blood sugar stability. And then we want to fill a quarter of our plate with carbohydrate foods. So things like brown rice, oats, sweet potatoes, which is a starchy veggie. So sweet potatoes, corn, lima beans, those type of vegetables, those starchy vegetables fit into this carbohydrate food category. Crackers, any type of fruit, beans or legumes, and then dairy as well. And of course, trying to drink water throughout the day instead of beverages with added sugar, because that can not be so good for our blood sugar stability. So when we're thinking about, what to eat and meals, diabetes plate is always a go-to of trying to think about, how to create your meal so it is balanced. So understanding carbohydrates, so sometimes carbohydrates have a negative connotation to it, but carbohydrates are a very important food group to incorporate into our diets, even if we obviously have diabetes. So why do we need carbohydrates? Well, they are the body's main source of energy. So the body breaks down carbs into glucose, and it fuels many different types of things in our body, like our brain, muscles, and other organs. But also carbohydrate foods also can supply some other key nutrients that we need for overall health, like B vitamins for energy and iron and potassium for heart health. So some food examples of carbohydrates we went over in a little bit of the slide beforehand. So food examples, things like whole grains, which will have the additional fiber. So brown rice, oats, quinoa, fruits and starchy veggies, so corns and peas, legumes like beans, lentils, chickpeas, and those types of things, and then dairy, so milk, cheese, and yogurt. We always want to remember too, we want to limit or try to limit refined carbohydrates, so ones with added sugars. So if we're consuming a lot with sugary drinks or candy, desserts, white bread and rice, this is definitely going to have an overload of carbohydrates and sugars that we need, and also not a lot of fiber. So it's really going to have the blood sugar spikes and dips, which is not so good. Definitely going to affect our blood sugar stability. And that's something to keep in mind too. So this is kind of a carb range that we want to aim for if we do have diabetes. And of course, this is a range. Everybody's a little bit different, but for breakfast, lunch, and dinner meals, around 45 to 60 grams of carb is considered kind of a normal range. And then snacks, which we always remember we don't want to skip snacks, about 15 to 30 grams is pretty good for carbs. But again, with blood sugar and different levels, kind of everybody's a little bit different of the carb ranges, so it's very individualized, but those are good ranges to aim for. And then when we talk about understanding carbohydrates, I wanted to give some examples of what 15 grams of carbs looks like. So one slice of bread, half cup of cooked cereal, or a third cup of cooked rice or pasta. If we're talking about fruit, just one small apple or banana, 15 grapes, 1 cup of plain yogurt, 10 ounces of milk. So just kind of giving you idea of the amounts of what 15 grams of carbs looks like. But I also wanted to include some products that we have in store, just thinking about carbs that we want to incorporate into our diets. Of course, thinking of portion size or keeping that in mind. But white quinoa was a great one, so our microwavable pouch. The Greek non-fat yogurt. So for 1 cup, I believe in the Greek non-fat yogurt, which has a little bit more protein, um, I'm trying to think. I think it was like a little bit less than 15 grams of carb, but definitely has some great protein in it. So then we have brown rice for that fiber. We already have pre-cut sliced apples, which is good, low sodium black beans, and then our whole wheat bread, which has some good fiber in it. So again, when understanding carbohydrates, these are some carbohydrate foods, just giving portion size amount for what 15 grams of carbs looks like. And then the role of fiber, which I've already have talked about a little bit, fat and protein. Combining these with carbohydrates is very important because all three help to stabilize blood sugar when paired with carbohydrate foods. So we know that fiber, which of course as Americans, we definitely don't get enough fiber per day. So fiber is a very important thing to think about because fiber slows down how quickly glucose or sugar enters the bloodstream. Again, helps to prevent those spikes and dips in blood sugar. So best sources, so vegetables, fruit with the skin, so apples with the skin on them, or pears with the skin on them. Whole grains, so whole grains like brown rice, whole wheat bread, beans, lentils, nuts, and seeds. And we want to try to aim for about 25 to 30 grams per day, which I think the average is a lot lower than that. So we always want to aim for higher. And then with protein and fat, they both help to slow the digestion and absorption of carbohydrates, so reduces the speed of glucose release. We always want to remember to try to keep portions moderate, especially with fats, because that can, of course, increase caloric intake. But fat is definitely important, especially those healthy fats, important for our brain health, heart health. But we always want to keep them on portions moderate because a little bit goes a long way. So healthy fats meaning avocados, olive oil, nuts, seeds, fatty fish like salmon. So here's a pairing example of how they, some like this would get considered kind of a snack, but they all work together to provide blood sugar stability. So whole grain toast, which is so like carbohydrate, peanut butter, protein, and then sliced banana as well. So that would be good for blood sugar stability. All right. So that's a little bit about kind of the just a general overview of diabetes and nutrition. But I'm going to hand it over to Haley, who's going to talk a little bit more about the medication side.
Thanks, Charlotte. As she said, my name's Hallie. I'm a pharmacist with the Giant Company. You won't find me in any particular store as I do float around and help out at the different ones. So we're just going to review some of the diabetes management basics today. So for example, I want to talk about some common oral medications as well as some common injectable medications. I also briefly want to touch on supplements, the vaccine recommendations, and then some common questions that we get asked. So first off, some of the common oral diabetes medications are going to be the first one of metformin. So as Charlotte said, just a reminder that there is a difference between type 1 and type 2 diabetes. And with that being said, the medications do differ a little bit. So for example, metformin is one of the first line medications with type 2 diabetes um, so metformin is also unique because it's going to work a few different ways. So it's going to increase that insulin sensitivity, meaning that we will be able to sense and use it more. It's going to decrease glucose production from the liver, and it's also going to decrease glucose absorption into the intestines. Other common medications you might hear about or see, or maybe you even take with the diabetes, are going to be glipizide, glimepiride, and glyburide. These are all part of the same drug class, meaning that they're all part of the sulfonylureas. And how they're going to work is they're going to stimulate the pancreas to secrete more insulin. Basically, they're going to use the pancreas as a punching bag, and they are going to make it produce more insulin that we can then use. Additionally, we have Jardiance, Farxiga, and Invokana. Again, these are together because they are part of the same drug class. They are considered an SGLT2 inhibitor. They are the common ones of that drug class, and they are going to work by increasing the amount of glucose that's excreted in the urine. So typically your body, when it does excrete, is it's going to reabsorb some of it, and they are going to decrease that reabsorption. Additionally, the Jardiance, Farxiga, and Invokana are some of the common ones of that drug class because they also are going to benefit that cardiovascular and chronic kidney disease as well. So they're going to work together with some of the other complications that you might have with diabetes. Next, I do want to talk about some of the injectable medications. So we have Ozempic, Trulicity, and Victoza. These are very similar to metformin as they are going to work in numerous different ways. They don't just have one particular mechanism of action, as we say, of how they're going to work. So they are going to increase that insulin secretion. Again, We need that to help us. And then it's also going to decrease the glucagon secretion and improve satiety, meaning you're going to feel fuller for longer, decreasing the amount that you might eat in between those monitored meals. When we talk about insulin, it is a necessary medication. However, there are numerous different types of it. So you might hear somebody say short acting, intermediate acting, long acting. You might hear somebody say ultra long or rapid acting as well. If we were to take the insulin and separate it into two very broad categories, we have the long acting insulin and the short acting insulin. Long acting insulin is going to work throughout the day and it's going to mainly lower that fasting blood glucose levels. So the fasting level is going to be that level when you wake up in the morning and you take your blood sugar right before you eat anything. That is your fasting level. Um, yes. Short acting insulin. Oh, sorry. Can we go back for a second? Thank you. Short acting insulin is going to be working in a shorter amount of time period. It's going to help lower glucose levels after meals. So this is considered your mealtime insulin. For examples of the short acting are going to be a Humalog, Novolog, Humulin, Novolin. Some of the longer acting medications are going to be that Levemir, Tresiba, Lantus, Basaglar. Alrighty, I am good to move on. Thank you. So I did just want to touch on some supplements because they do come up often. So some of the common ones that come up are going to be cinnamon, vitamin D, turmeric, and chromium. The guidelines that we use with diabetes is going to be the American Diabetes Association. They have a standards of medical care, and they state that there's no clear evidence that the vitamins, herbs, spices can generally improve outcomes for patients with diabetes, and they are generally not recommended for helping control blood sugar. Obviously, if you go to your doctor and they test your levels, there are some patients that would benefit from taking a supplement, but that would be completely with your doctor and the levels that they're testing. So if we move on, I want to touch on some of the vaccine recommendations. As Charlotte said, diabetes can impact a lot of different areas of your life as well. So diabetes can increase your risk factor for some of the other things, for example, pneumonia or flu. So some of the vaccine recommendations with diabetes are you do want to get your yearly flu vaccine. Additionally, the pneumonia vaccine you do want to get as well. There are different types of that. So depending upon what pneumonia vaccines you've had in the past, it would vary depending upon which ones they're recommended at this point as well. Hepatitis B is another vaccine recommendation for those under 60. If you are over, it is between you and your doctor to have a clinical discussion of whether it would benefit you or not. COVID-19 vaccine, again, is recommended. Um, you might have seen come out eh, somewhat recently, a little back ago, that if you were over the age of 65 and it's been more than 6 months since your last COVID-19 vaccine, it is recommended to get a second one. Um, However, COVID is going to be one of those that will come back again later. So additionally, respiratory syncytial virus is another recommendation, especially uh, you might hear it referred to as RSV. That's more common. It is a single dose. It is not a yearly vaccine. If you've gotten it once, you are good. You don't need to get it again. And it is, again, age-based and as well as the risk factor. So diabetes does count with that. Zoster is more commonly known as the shingles vaccine. So that one, again, eh, within the last, let's say, 10 to 15 years, they did come out with the two-dose vaccine. So if you haven't gotten the two-dose vaccine and you're over the age of 50, it is highly recommended. And it is a two-dose vaccine where the second dose is 2 to 6 months after that first dose. Additionally, I'm sure we've all heard of the Tdap vaccines, the tetanus, diphtheria, pertussis. That is recommended every 10 years for everyone, especially you just want to make sure that you're getting that to help prevent. Okay, so if we go to the next slide, please. I do just want to briefly touch on this. Unfortunately, or fortunately, however you want to look at it, diabetes does require a lot of medications to control it for most people. If you're one of the few people that don't require a lot, that is awesome. But unfortunately, for most people, that does mean that they have to keep track of and manage multiple medications. Giant offers something called Time I Met. It's a medication synchronization program. I do just want to mention it in case you're interested. It's where we will sync your medications for you and you can pick up your medications at the same time. So instead of having to come through once a day or every single day of the week and pick up something new, you can talk with your pharmacy team at your pharmacy and they can review your medications that you pick up with them recently and get you signed up for anything that is eligible. The benefit is that if you are out of refills, we do reach out to the doctor for you. So hopefully you don't have a gap in your treatment. Okay. So just want to mention some of the common questions that we get. So do generics work just as well as the name brand options? They do. They are the same active ingredient in them. Um, you will hear people that want specifically brand name, and that is okay. We do need that specified. But in general, generics do work just as well because it is the same active ingredient. The next question that's very common is going to be what happens if you don't take your medications, particularly your diabetes medications, regularly or as prescribed? Again, without knowing exactly what you're on, I can't say exactly. I can't say for certain. I'm sorry. I keep saying exactly a lot. Um, but in general, it's not going to work as well as it should. You're not going to have as well controlled diabetes. You're not going to have as well controlled A1C levels, or your fasting and your mealtime insulins are going to be adjusted. Next, one of the common medication questions that we get for both diabetes as well as a lot of other disease states is how do you dispose of that unused or expired medications? In general, the best option is to do a drug take back day. So about once to twice a year, Giant does participate with the local police departments and do that. So you can look at up the next date of that. I'm sorry, I do not know that off the top of my head. But also, if it's in between those, your local police station, typically all of them do have a drug disposal box in their lobby that you can use, and you can go in and dispose of your oral medications that way. If they don't have one or you can't get to one, it is recommended that you put it in like a Ziploc bag with some of the undesirable substances. So, for example, coffee grounds or dirt. Mix them up and then throw them out with that. For your injectable medications, you do want to be careful because they do have those needles with them. So that Giant can either, if you ask your pharmacist, we do have the ability to order you in a personal um, needle disposal. So a sharps container, you might see them in bathrooms and public restrooms, or you might have seen them with Giant. As we give vaccines, we will throw the needle in there. If you don't want to do that, another common option for most people is that if you take like an old laundry detergent bottle, so think of that thick, heavy plastic, and some people will dispose of those, you do got to check with your trash disposal company, as sometimes they do have different ways that they need you to dispose of that with the trash, depending upon how you wrap it up or if it has to be separated or whatnot. But that would be another option. I believe that is all of the common questions that we had. Oh, thank you. Some of these diabetes management resources are pretty good. So Cleveland Clinic, if you go to their diseases page and then diabetes, that one's a good one. Diabetes.org. And then the NIDDK.nih.gov is a health information overview for diabetes as well, which is nice.
All right, thank you. Hey, thank you. There are some Q&A questions. Is it okay if we just answer a couple of them? Okay.
Yes.
Okay. Okay, so and I think they're mostly for you. So the first one is, are people listed as diabetics if taking metformin, or are they diagnosed as pre-diabetic?
Metformin can be used for prediabetes as well. It can help lower that A1C overall. So you'll see metformin used in prediabetes as well as diabetes. So it could be either or.
And let's see. And are there negative outcomes or risks with the mentioned supplements? Is it okay to take them?
There can be some negative outcomes, yes, but in general, it's just not recommended because they don't have that proof that they work. You don't want to overload your body with too much of the same things, then how are you going to get rid of it if you have too much? It really depends on how that is excreted, whether it's through your kidneys, through your liver, through your urine. Um, if you're interested in taking supplements, I would talk to your doctor, get them to test your blood or get them to make specific recommendations based upon your um, process. I'm sorry, your what other medications that you're on, as well as how your diabetes is being managed or progressing.
Okay. And then another question, is it better to be on a pump versus the shots?
It really depends on what's best for you. It doesn't like they both work. A pump is typically that going to be that basal insulin, so you're fasting that long acting insulin. Um, it pumps can vary. You got to get them processed through the insurance. So people that do have pumps are typically going to be the ones that have gone through that process. I haven't heard negative things about them, and I haven't heard negative things about the shots either, for the most part, with actually doing the injections yourselves.
Okay. Um, and the next one, I was saying, like, or do they have the option to plant cells from someone who is not diabetic to someone who is?
That's a great question, and I don't know that answer. I apologize. Um,
It'd be-
I can't say I've heard of it, but neither have I ever looked into that.
Yeah. Okay. And then the last Q&A is, what should your A1C be?
In general, I don't want to answer this specifically only because it does vary based upon your age, based upon what medications you're taking. Um, that is a question for your doctor because they do have very individualized A1Cs for people. Um, so I apologize, but is very individualized for a lot of people depending upon the medications, your age, as well as if you have any other medical conditions.
Right. And then we just had one more that came in. Does type 2 diabetes always keep progressing, or can it be stabilized with meds for a lifetime?
Meds will help. It can help prolong it, but eventually your pancreas can stop producing insulin as well.
Okay. All right. Those are all the Q&A questions. All right. So I hope everybody learned a little bit something about diabetes and then the medication side as well. I want to thank Hallie for being here today and to talk all about the medication supplement side of it. I just want to mention our upcoming Wellbeing Connection class, which will be with Joni, and she will do a deep dive into diabetic meal planning with recipe inspiration and products. So definitely, if you haven't registered for that, definitely check that out. But we appreciate everybody being here today. So thank you and take care and have a great day. Thank you.
Thank you.
Bye.